You must promptly correct the record by removing your videos, posting a public apology to UnitedHealthcare. We also expect you to contact Newsweek and any other media outlet who has reported on this issue and inform them that your claims were false. But UnitedHealthcare, instead of even pretending to try and reform some of its predatory practices, it's just absolutely insane. Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up. Hey, it's Jordan with Status Coup. I know there's a whole lot going on and everyone's dizzy as President Trump continues to nuke the federal government and hand the keys to Vice President Musk. However, what I am about to show you is absolutely bonkers, truly unreal, although not shocking, and cannot be swept under the rug. Remember a few weeks ago, a doctor in Texas did a video that went viral describing a call she got mid-surgery. She was in surgery for a breast cancer patient from UnitedHealthcare, as UnitedHealthcare essentially arguing to deny coverage, deny funding, paying for an overnight stay for this breast cancer patient. Let me show you the video if you had not seen it.
It's 2025 and insurance just keeps getting worse. I just did 2 bilateral deeps and 2 bilateral tissue expanders for patients. And I've never had this happen before, but during the second deep, I got a phone call into the operating room saying that United Healthcare wanted me to call them about one of the patients who was having surgery today, who was actually asleep having surgery. And, said I had to call right now. So I scrubbed out of my case and I called United Healthcare, and the gentleman said he needed some information about her, wanted to know her diagnosis and whether her inpatient stay should be justified. And I was like, do you understand that she's asleep right now and she has breast cancer? And the gentleman said, actually, I don't. That's a different department that would know that information. And I was like, well, she does need to stay overnight tonight. And you have all the information with you because I got approval for this surgery. And I need to go back and be with my patient now. But yeah, it's out of control. Insurance is out of control. I have no other words.
Well, that went viral. Millions of people saw it. It confirmed what we already know, that UnitedHealthcare, among other for-profit healthcare predator killers, doesn't care about patient care and is willing to essentially try and fight paying for and covering a breast cancer patient's overnight hospital stay. Well, that doctor who bravely exposed UnitedHealthcare's latest predatory practices got quite the letter from UnitedHealthcare, essentially threatening to ruin her livelihood, bankrupt her, and take her to the cleaners. Yes, UnitedHealthcare is fighting back against the doctor who exposed their predatory practices, trying to deny a breast cancer patient's overnight stay. Let me show you first her Instagram post announcing this letter she received. It's really unbelievable. This is Dr. Elizabeth Potter, who, by the way, I've reached out to for an interview. So hopefully she says yes. I recently shared a video after I was asked to call UnitedHealthcare from the operating room to answer administrative questions about the patient who was having surgery to treat breast cancer. Despite my efforts, they denied her stay. Let that sink in. They denied a breast cancer patient's overnight stay. I spoke out because this has simply gone too far. I'm sharing UnitedHealthcare's letter to me in its entirety. I'll let it speak for itself. My words were true and the situation was absurd. I followed all safety protocols and my patient was with my co-surgeon who continued operating. I had requested an overnight stay for medical reasons. This was not an error on my part. Let me repeat. She says she requested an overnight stay for medical reasons. This was not an error on her part. The gaslighting and harassment in the letter, which United sent me, has not worked to do anything other than strengthen my resolve. I will continue to speak honestly, clearly, and plainly about the state of healthcare in the United States of America. So, I'm not going to read this whole letter because it's 6 pages, but I'll read some of it. It is, even for me who's just seen it all, in this United Corporations of America, this cesspool of capitalist for-profit social Darwinism that basically would rather save a couple pennies on the dollar than, have a cancer patient be safely treated. Even this letter to me is kind of stunning. And I want to remember, she said in the video, she was told I had to call right now. So it was told to her, United wanted her to call right now about whether her inpatient stay for her breast cancer patient who's on the table in surgery needs to be justified. Well, let's take a look at United, who clearly hired a high-powered defamation firm to try and intimidate and threaten the good doctor to take her video down and apologize to the innocent victim here, United Healthcare. Dear Elizabeth Potter, Clark Clock LLP is defamation counsel for United Healthcare. We're writing to demand you correct your knowingly false, misleading, and defamatory social media posts regarding United Healthcare. In short, United Healthcare never asked or expected you to step out of surgery to make a phone call, and any suggestion that we did so is false. On the morning of the surgery, your office incorrectly ordered an inpatient hospital stay when you meant to order an outpatient observation stay. Had you not made that error, United Healthcare would not have reached out. You have taken actions on social media to defend your actions and remove comments that are critical to you, while failing to remove threatening, harassing, and intimidating comments directed at others. Oh, pity the billionaire United Healthcare company. So let's forget for a second, just put aside, whether they did call during surgery, whether they didn't call during surgery, whether they meant to have her leave the room and call them back right away. To hell with the fact that she was in surgery. Put that aside for a second. Let this sink in. United Healthcare is literally in writing, or its, corporate defamation firm is telling the doctor your office incorrectly ordered an inpatient hospital stay, meaning an overnight stay, for a breast cancer patient having surgery that day, when you meant to order an outpatient observation stay. Why are you, United Healthcare, telling the doctor what she meant to do, or what her office meant to do? How do you know what she meant to do? And I'm not an expert, I'm not a doctor, but I don't know. I watched ER a few times. I watched, Dr. House. Common sense. What doctor for a breast cancer patient having surgery that day would not order an inpatient overnight stay? Breast cancer surgery is not the equivalent of like getting your septum fixed, for you, those of you who have had a deviated septum, which would be an outpatient surgery. You're probably, being discharged hours later. I would think 10 out of 10 breast cancer surgeries are going to be an inpatient stay, but they are telling her you incorrectly ordered an inpatient hospital stay when you meant to order an outpatient. That's beyond gaslighting. That just doesn't make sense. You're telling the doctor she meant to order an observation stay. What are you observing? She has breast cancer. I don't think any breast cancer surgery is minor. I don't know the nature of the surgery, but most common sense people with a brain would think you probably need to stay overnight, not be observed to then decide if you need to stay overnight, but just right away, the plan is you're going to stay overnight. But they're gaslighting her that she made an error. Again, she said in her Instagram post, let me repeat, her Instagram post says, I had requested an overnight stay for medical reasons. This was not an error on my part. So who are we to believe? The predatory for-profit health insurance company that is defrauding seniors and elders through the Medicare Advantage scam, the predatory for-profit health insurance company that is using AI with a 90% error rate to deny more claims of elderly seniors and others, or the good doctor? I'm going to believe the doctor. I don't know about you. Let me know in the comments. But the gaslighting gets even worse. it gets way worse. So United Healthcare, after telling her what she meant to do with the nonsensical, you meant to order an observation stay for the breast cancer patient, you must promptly correct the record by removing your videos, posting a public apology to United Healthcare, and condemning the threats of violence aimed at our client resulting from your posts. What about defamation? Does she need to condemn threats of violence? That's not her responsibility to condemn threats of violence against United Healthcare. We also expect you to contact Newsweek and any other media outlet who has reported on this issue and inform them that your claims were false, that you unequivocally retract your claims, and that you are requesting them to remove all stories about your claims. As you know, on January 7, 2025, you posted a social media video in which you falsely claimed that United Healthcare required you to leave the operating room during a surgery to discuss the patient coverage, among other things. Then they repeat what she said in the video, bolding certain things. The patient you referenced was scheduled for surgery at Hospital Corporation of America, St. David Medical Center in Austin, Texas, on January 6, 2025. As you know, United Healthcare had already approved a previously submitted prior authorization request for outpatient surgery for this patient. But Hospital Corporation of America has informed us that your office notified them on the day of the surgery that the patient should be admitted for an inpatient stay rather than the observational stay that would have been ordered and was already approved as part of the prior authorization. That was your error, which you subsequently acknowledged to United Healthcare, blah, 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 blah. I'm not going to read all of this because it's just absurd. I just don't believe that this doctor put in for an observation stay, which means we're going to observe you. We could release you same day, or we could decide later that you need to stay overnight for inpatient, and then we would, try to get approval for that. I don't believe that. Do you believe that? I mean, a breast cancer patient getting surgery? I think most doctors would, at the start, put in for an inpatient hospital stay. That's not something you want to just, try to rush them out of the hospital. You need to observe them after the fact. It's probably not a quick recovery. There might be medications they need to take after the surgery, to prevent infections, et cetera, et cetera. I don't buy it. And again, why would the doctor have any reason to lie about this? Is she trying to go to Hollywood to do this viral video? And by the way, to be clear, let's go back to her original letter, her Instagram post about this. United Healthcare, according to this doctor, ended up denying the breast cancer patient's overnight stay. That is the takeaway here. Not whether United called her mid-surgery or not, which I absolutely believe they did. I absolutely believe the doctor when she says she was told from United, call us now. And I absolutely believe that they denied a breast cancer patient overnight care, meaning inpatient stay. But United Healthcare, instead of even pretending to try and reform some of its predatory practices, which their shareholders, apparently this was reported a couple weeks ago, I reported, the shareholders wanted a report on their denials and excessive rates of denials. I guess that report is still in the works since they're still doing this predatory, inhumane garbage, which, by the way, that jeopardizes the patient. I don't know the nature of the surgery, but a breast cancer patient, if you're going to then try to rush her out of the hospital, there's risk of infection and what else? Of course you need to stay overnight, possibly more than one night if you're getting surgery for breast cancer or most cancers. This is not like, hey, a quick cosmetic surgery here or sinus surgery. It's just absolutely insane. I'll just read you the end because, again, it's just more threatening, more threats and whatnot. So your claims are false. You clearly know they are false. You falsely laid the blame for your office's error on United Healthcare publicly, unleashing a firestorm of dangerous misinformation. We expect you to promptly correct this publicly by removing your videos and posting a public apology to United Healthcare that explains that the reason for the call was your office's erroneous submission of a notification for inpatient care, again, telling her somehow she was in error to ask for inpatient care for a breast cancer patient when you meant to order overnight observation. It's just truly stunning. We further expect you to promptly contact Newsweek and inform them your claims were false, that you unequivocally retract your claims, and that you are requesting Newsweek remove their stories. Well, essentially, the good doctor has said, fuck you. And kudos to her, because this is straight up corporate bullying and predatory bullying. And to be clear, UnitedHealthcare, who apparently didn't care if this got out, maybe they thought they could just intimidate and threaten and coerce this woman, this doctor, into doing this for fear of bankrupting her with God knows the cost of legal bills if they actually pursue a claim against her. But UnitedHealthcare, they're trying to distract here that the main issue is correcting that they called and hushed a doctor out of surgery. That is a major issue and problematic. Obviously, she would not have left mid-surgery without a co-surgeon there to cover her. The main issue is you are trying to deny a breast cancer patient inpatient overnight care, and you did deny said breast cancer patient overnight care. And then you're trying to gaslight and manipulate the doctor into thinking she made a mistake. No, it wasn't a mistake. You made a for-profit, greedy decision, and this is one of a million you are making a day. Vile and disgusting. And the media wants to wonder, why are people so angry at the healthcare industry? Absolutely nuts. We will stay on all stories we can on the predatory, evil, immoral, capitalistic hellscape that has been ushered in by the for-profit healthcare industry. And like I said, I did request an interview with this doctor. Support Status Coup for as low as $5 a month. StatusCoup.com/join helps us stay independent and on top of these stories.